Hello everyone, I am presenting a retrospective study of pediatric uveitic patient which we saw in our OPD from last 7 years data. So why we did this study? We want to know what the etiology of the disease and what are the major cause factor in the South Indian population. That is, we did a study at Narayan Nethralaya, Bangalore. So in globally, the uveitis at the pediatric population is around 5 to 10%, and in comparison to North and South India, its prevalence is around 3% at North and around 6% at South. So early recognition of this condition is important. So it was retrospective study. It was performed from 2015 to December 2022, and this data we have taken. Inclusion was less than 18 years of age and exclusion was more than 18 years of age. So there was 1,000 eyes of 687 patient as children, and mean age was 11 years. The gender wise, what we have seen is the male were predominant versus female. The ratio is 58:42%. And if we classify it to age wise, then more than as we have seen the uveitis, as the children grows, the uveitis incidence in them is increasing. So this is anatomical classification. What we have seen is majorly were based in the posterior uveitic group and less in the anterior uveitic group, as been quoted in other various studies. And if we classify on etiological basis, in our study we have seen the infection were the major cause, followed by other idiopathic and non infectious causes. In case of infection, what we have seen majorly is the toxo and the TB were the major. Rest other are in less percentage. Now on follow-up duration, what we have seen in the uveitic age group pediatric patient, the majorly complication they develop is the cataract, followed by macular scar formation as the posterior segment complication. The treatment which we have given most to them is the oral steroid, followed by systemic medication like for antibacterial and antiviral medications. Now we try to classify it into the age-wise distribution. Neonate less than infant less than 1 year, 1 to 6 years, and 7 to 12, and more than 12 years. So what we have seen is the infection is as age rises, the incidence of uveitis in them rises. This is same in as case of infectious and non-infectious, but infection we have found infections more in the less than 1 year of age versus non-infectious group. And toxoplasma versus tuberculosis, as these were the major our infections pattern, toxo was predominant in the less than 1 year of the age group versus TB. In non-infectious, VKH was the leading cause. It's most found in the more than 12 years of the age group, and this is the complication: cataract and macular scar. These are the anterior and the posterior segment complication. As we have seen, as the age increases, the complication in them increases with age, and posterior segment scar also increases with age. So as we have seen the pattern, when we try to correlate between them, as the cataract pattern and the macular scar pattern follow the same graphical representation. That means if patient is having cataract, then might be patient is having some posterior segment finding also. Oral steroid was started, and it was major in the more than 12 years of age group. This is our sample study size. It was 687 children. Comparison with the other study, we have the largest group of the patient, and the posterior uveitis we have found in 41% of the population, whereas the rest of the population it's somewhere like 11 to and 27%. So other study, when we compare, the age group was the similar with our study was similar, comparable, and the majority of our study is having posterior uveitis, whereas anterior uveitis been reported in other northern group of population. And the cataract surgery was performed in our study also and other study also, and complication was cataract in their study also, and everyone started with topical steroid in their treatment. So posterior uveitis is the most common cause in our study, and complication is cataract followed by macular scar and retinal detachment, and we started mostly on the systemic steroid therapy followed by methotrexate. This was.
I liked your study, but I think somewhere some stats were missing, like the proper comparison between infectious, non-infectious in different age groups. So I think there is no more need to like work on it, because whenever we do such kind of epidemiological studies, so it should give us a very clear idea, like this age group, this many infectious, and as compared to the non-infectious. So that is the main, I think, basis for the study. I think these things were a bit missing. Then more, they need to work more on stats.